Well, that's not what we hear. What we hear is, for example, somebody who went to the GP in January 24 was told that they would get the help they needed, didn't hear anything back for weeks, was going through a very, very bad time, rang 111 a number of times, was told to go to an appointment the following day, but an appointment with a GP or a mental health practitioner, but not a specialist, who would talk to them about going on medication. That's not what the person needed. And when the person said, I don't want to go on medication because it makes me feel very bad, it makes me feel worse, and it doesn't solve the problem, they said, what do you want us to do? What do you want us to do? Anyway, this person is a long story, a very difficult time for this person, and who was feeling suicidal, who wanted help because they couldn't cope with the feelings they had, and this is what they get. And they have to wait. They've been waiting, and eventually they managed to see somebody in December 24.
And that's not the only case that you've spoken about. So I want to ask you, why do you think there's a discrepancy between what you're hearing on the ground and the figures that the Minister has?
Well, obviously, what we hear, we hear stories from people who are not happy with the system. And we don't hear all the stories. We just hear a handful. But you get the impression, I find it hard to believe that something like this happened this last year, and somebody else who's told me they've been waiting for 8 months. And that they were told in December. They were on the list from July, from May 24, in December 24 they were told that they had to wait longer because they're still dealing with the backlog from October 23. If that is the case, I don't see how they can say that they're bringing them down to 20 weeks, which is still a long time to wait if you're feeling really bad.
Let me ask you about the mental health facility. The Minister said that they are now considering 2 buildings, one which is the Old Chronicle and another one that the Minister didn't name. What are your thoughts on where that is at the moment?
I have no idea where that is. I find it all very strange, as do quite a lot of people who are interested in the subject, because we were told in July, I think July 24, that the Minister was really happy, excited about this wonderful site that they'd found, and it was going to be really good for the enhanced mental health community team. And then it all goes very quiet. We don't hear anything about it. GBC ran a story about it. We put a question about it. We didn't get any answers. And now in Viewpoint, the Minister said that they have a new site and that this could be better. Well, it would be interesting to know what is going on, and it would be good to know when they're actually going to do it.
Let me also ask you about comments made by the Minister on the subject of sheltered accommodation. That is something that you have championed for a long time. What did you make of her comments? She said that they were only at the very early stages of discussion.
That fills me with dread, because that means that it could be, 10 years down the line or 15 years down the line. I think this needs to be given priority. There are many people living on their own in the community, living very badly. People usually with very small financial means, who don't make it to the end of the month, who need to rely on charities. Whenever an appliance breaks, we buy fridges and cookers and all the rest, as do other charities. That's not a great way to be living. I think it would be much better to pull these resources into a place that was properly run by mental health trained nurses, and where people had companionship and weren't living on their own, scattered in the community.